Circadian rhythm sleep disorders, often known as CRSDs, are susceptible to being affected by a wide range of risk factors. The following is a list of some of the most important factors that can result in an increased risk of having CRSDs. Elements that pose a danger of developing CRSDs. 1. As you become older, the pattern and timing of your sleep-wake cycle may shift. This is something that might happen. The natural inclination of adolescents to go to bed later and wake up later is a factor that contributes to the increased likelihood that they will develop delayed sleep-wake phase disorder, DSWPD. The likelihood of older persons developing advanced sleep-wake phase disorder, ESWPD, and other sleep disorders is increased because they may go to bed and wake up earlier than younger adults. 2. In terms of either the environment or the occupation, a higher risk of developing shift work disorder is associated with individuals who work night shifts or who have irregular work hours. Individuals who travel frequently, particularly those who cross numerous time zones, are more likely to suffer from jet lag disorder. 2. 3. The history of your family or your genetics. Your sleep-wake patterns can be affected by the genetic predispositions that you have. The risk of CRSDs can be increased by variations in genes that control the circadian clock. There is also the possibility that a family history of sleep difficulties is a significant factor too. 4. Habits of lifestyle. Certain lifestyle decisions, such as the following list, have the potential to alter circadian rhythms. The consumption of alcohol can disrupt both the quality and timing of one's sleep hours. Regular consumption of caffeine can cause a delay in the start of sleep. Air travel is especially common while traveling between different time zones. The use of illegal drugs has the potential to interfere with natural sleep patterns. Inadequate exposure to natural light can have an effect on the body's internal clock. This is because daylight exposure is essential for health. Circadian rhythms can be thrown off by unhealthy sleeping patterns, such as irregular sleep schedules and exposure to artificial light at night, for example, from screens. Other medical issues include the following: neurodegenerative diseases, such as Alzheimer's disease, dementia, and Parkinson's disease. Certain health conditions can raise the chance of chronic recurrent spinal cord injuries, CRSDs. Some examples of genetic conditions include Smith-Magenis syndrome and Angelman syndrome 12, among others. 6. Stress and mental health. Sleep patterns and circadian rhythms can be disrupted when there is a high amount of stress and mental health illnesses, such as depression and anxiety. 7. Physical activity. Not getting enough regular exercise or working out too close to bedtime might have an impact on the quality of sleep and the timing of you falling asleep. By gaining an understanding of these risk factors, one can improve their ability to identify and effectively manage CRSDs. In the event that you have any reason to believe that you may be suffering from a circadian rhythm sleep disorder, it is imperative that you seek the assessment and treatment of a qualified medical expert. If there are any further questions or if you require additional support, please do not hesitate to ask.